To start a Botox and filler demonstration. I'm Kara Richardson, one of the PAs here at Premier. And what we're going to do on my lovely Aunt Sarah is some jawline contouring with some filler. So we're going to try to sharpen her jawline. And some of us just aren't blessed with that beautiful sharp edge to her. You know, in a contour that we all want right here in the neckline. And some of us aren't blessed with a really prominent chin. So we're going to give her a little bit of a chin too. Along with treating her with some Botox in her neck and her chin area. So as we age, this chin muscle gets really strong and it wants to almost look contracted all the time, which gives a little dimpling effect to the chin. So we're going to soften that with some Botox. And then the other thing we're going to treat, Sarah, can you do this one? We're going to treat these bands that are in her neck that want to pull down and create some of this jowl effect. So if we release this with Botox and you can relax, we actually help our filler work better. So those are kind of the things, and we're going to start with just the Botox. And anybody who's here wants to, feel free to just come on over. Thank you, Bert. And with the Botox, what we do prior to it is usually just some ice. She's been numbing with some topical numbing because we were numbing for the filler too. But most of the time, Botox will just do a little bit of ice. So I'm going to put that on there first. And then she's going to get 3 little injections to treat this muscle. So one here in the center. And then 2 a little farther down. And when this relaxes, you really will see this line beneath her lower lip soften because it will allow that muscle to release. And then, like I said, this dimpling or textural change that we get with age will actually smooth out. So, there we go. And then on her neck bands, do it one more time for us, Sarah, and then relax. I grab them, and we're actually just treating it in a few spots with the Botox, because the Botox just helps to soften the tightness of these bands. And it does help some with the lines that we see in the neck, but if we really wanted to address all these small little lines, you would probably need some filler in it too. You can do some micro Botox and it'll soften that crepiness, but the filler's better for it. Or laser treatment, where you're actually resurfacing it. Okay, do it one more time for me, Sarah. So I'm going to treat this.
Kara, when will she see the effects of Botox?
So the Botox will take 7 to 10 days to be in full effect, whereas our fillers are more instant. And then your Botox is going to last about 4 months. Make that one more time for me. Okay, and relax. The other reason I treated these underneath here, she didn't have as strong a one on this right side, is because it will also help sharpen that curvature underneath the chin that makes more of the sharpness of the jawline too. So, and then we're also treating her lips today, so I'm actually going to start with her lips, just because we want them as numb as they can be, and we just took the numbing cream off. So she doesn't want a big lip, we just want to hydrate it essentially, and smooth out any fine lines that are around the edge. So we're going to use a Juvederm product called Bobella for that, which is the most natural, has very little swelling usually after, but you should always expect 48 hours of some swelling in the lips, okay? So we're going to start right here, kind of at the peak, and we're going to actually build it up just a little bit, because as we age, this point from the bottom of our nose to the top of our lip really gets flat, and it looks more youthful if we have those nice columns that lift up those peaks. So we're going to start by making those happen. Okay, so are you ready? And you can see just that slight raising and support that gives, okay? So we're gonna do the other side and then we'll come around. Come up, Sarah, I'm gonna put back on this. Yeah, so we're gonna do the same thing over here. Little pinch. So she's had numbing cream, if I haven't already said that, for about 20 to 30 minutes prior to the injections. And then the product itself has lidocaine in it also, so that helps tolerability of having those injections. So that was good. Okay, and now all we're going to do is give her just a more crisp edge, okay? And if y'all have questions, feel free, just ask. Very nice. I think I heard somebody else. Well, Bella's the product that we're using. But yeah. Yeah, so you can see just a little, and then this little line right here. So Bobella is a great product for even just the lines, even if you don't want fullness to the lip. We can go around and just treat these teeny tiny little superficial lines. And that's what I'm doing right now. And Sarah's we've done it once before. So it's probably been about 9 months, is that right?
Yes.
About 9 months since we treated them previously. Well, Bella usually, though, is about 6 months. So we've gone a little longer. So that's looking great. I'm going to fix this one more line. This one's going to go a little finish here. Perfect. Okay, so we're going to fix the other side, and then we'll do the bottom lip. Our bottom lip doesn't have a whole lot of lines, so we're just going to pull this too. One of the things that I do want to mention on lips, you don't want to have dental work 2 weeks prior or 2 weeks after the injections. This is the injection right now. So I'm just going to get them out there on this one. Okay, now I'm going to do the corners of her mouth, and then we're just going to finish up by putting a little fullness to the bottom. Is there one more?
No, do you want me to
You mean grab? We grab one. I'm just gonna put one more little spot. And that little. I'll work on the jawline. A little hydration. I'm gonna put just a little bit more in here, but while she's grabbing that, I'm gonna start on her jawline. Alright. So, Voluma is what we're gonna do for the jawline and chin. So what we're going to do here is start by kind of lifting this little sagging that we're having in the jowl area, and then we're gonna give even more pull to it by projecting that chin out just a little bit, okay? So Sarah, you ready? Okay. So it's gonna be a pinch back here, deep breath, and down. So Voluma lasts a little bit longer. It's gonna last anywhere from usually 12 to 18 months. And that's the beauty of the products, is they all have their place. So some are made for areas where we need more support, and some are made for these very soft areas like the lips. So if you can appreciate just a little bit of that angle that she's starting to get, and then we're going to continue down just a little bit farther. We did numbing cream before, yeah. She's had a little bit. But yeah, you can start to see it lifting. And then I'm going to actually come right here first. She's got a little gloss right here. Okay. Very good distraction. You see your jawline kind of getting softer and settled. And I'm actually going to come up just a little bit higher, just to give that support from here. So lift your lungs down, lift it, deep breath out. Very good. And if you'll notice, it even helps some with her nose lower here when you pull that out. I'll finish your work here, Sarah.
Okay. No, I'm good. Do you have a tissue? Just for my eyes.
Yeah, you just hold your couch and here. I swear that's not fear, that's just allergies. Yeah, I just wanted to make sure we got our ratio right on our top and bottom lips, so that's why we needed to switch it up. Very good. Okay, now we're going to finish up the album, and she's all done. Okay, so again, we're going to start kind of by pulling back chin a little bit. And we're not symmetrical, that's the first you're going to notice. So her left side is actually a little more, has a little more laxity than her right. So I'm going to finish up there and then I'll probably come back over and do some more left. So we're going to put some here. Jawline, good job. Okay? Okay, and then I'm going to put just a little bit in your chin to just give it a little more downward projection to make this curvature more defined. Okay? That's perfect. Okay, and then just a little bit on this other side. And then, and even from her profile, that just really helps to balance the face, because we do really want those ratios of kind of 1/3, 2/3, 3/3. So it's really important for that chin to balance it. Okay, ready? I'm gonna pinch you here, and we're almost done. That's it. So yeah, I just really hope, and she doesn't have a lot of bruising. We always tell people we can't promise. We try to avoid vessels as much as possible. We'll send you home with an ice pack, some arnica to help with swelling, and usually a little concealer kit if you have any.